to cover inpatient costs of prisoners can almost entirely be shifted from all state dollars. So I think that as we think about the federal deficit, and maybe it's counterintuitive, CBO says, were the ACA to sunset, it would have a negative effect on the federal budget. Whether you count macroeconomic impact when it's a huge, or you don't count and it's slightly less of a negative impact. And then on the last point about federal entitlement programs tending to increase dependency, I would resist that with respect to Medicaid. Medicaid is health insurance. It started in the 60s as a welfare program. It was linked to welfare, and until the 90s you couldn't get Medicaid unless you were also getting welfare. In 1996 it's delinked from welfare, and it is purely health insurance. And we know that individuals who work in some small employers who don't work full time, they're not dependent, they just don't have access to health insurance.
Last year, my collection rate was 101%. That's because of tips that the Gap population leave me. Even waitresses have tipped me. You know, I've heard radio ads about waitresses that have no access to health care. They leave me tips. My average fee in 2015 was $58, including medications, labs, and some of those visits being house calls. The federal government has dug us into a deep hole. They dig it deeper with every layer of interference. Now we find ourselves in this committee looking for a better shovel. Yes, I realize that this committee was tasked with finding the best shovel available, but I urge you instead to consider a rope. I offer an idea of where to find that rope. It lies not in any new government program, but in doctors creating free market practices in Idaho. If there were another dozen or so family practice doctors scattered throughout the state doing it sort of the way I do, then primary care would be taken care of without propping up with taxpayer money.